Hello everyone, this is Chadi Alraies from CVI 2022 in Denver, Colorado. I'm really privileged to have Dr. Mir Basir with me. He is an expert in cardiogenic shock and he's currently the director of MCS at Henry Ford. Babar, always nice to see you.
Thank you so much for having me, Shadi. I appreciate it.
So you have been pioneer and also developing multiple protocols for cardiogenic shock. So tell us about the story of development and how these protocols impacted outcomes.
Yeah, so we were in a position, in 2014 and 2015, where we were really using hemodynamic support very variably. Specific institutions had some experience, but overall not a lot. The utilization rate was less than 5%, and there was not a lot of randomized data behind these devices. And so we looked at a combination of observational studies and created a best practice algorithm that was associated with improved outcomes.
Right.
And then we clinically, with our own knowledge base and experience with cardiogenic shock, helped develop and protocolize care in AMI cardiogenic shock. And so we first pioneered this with yourself and others in Detroit, in the Detroit Cardiogenic Shock Initiative. So it was 4 hospitals where we did a quality improvement project, and we said, listen, if you put patients on hemodynamic support quickly after their AMI and their presentation, revascularize them, put right heart cath in, and get invasive hemodynamics, what are the outcomes of these patients? And we did that in 40 patients in Detroit, got very favorable outcomes, and that's where the expansion to the National Cardiogenic Shock Initiative came from.
Right. And walk us through the impact of this protocol from National NCSI on the outcome of shock of these patients. How does it change the outcome?
Yeah, so historically, even institutionally, we had about a 50% survival in cardiogenic shock. When you look at different databases and even other randomized control trials, that number is around that point. So we originally had about a 75% survival in Detroit. And as we expanded it to more centers, got experience throughout the country, it was 80 centers, and our overall survival was 71%. That was significantly higher in those with stage C and D shock, which are really the patients who we enroll into randomized control trials. Their 30-day survival was actually 77%.
Perfect.
So what I think it does is it gives us an idea that this algorithm works, that the use of Impella for cardiogenic shock can be helpful. And so we're going to be now going on to the next step. Greg Stone, Naveen Kapoor, Bill O'Neill are going to be leading the Recover 4 trial to see if this can be scientifically proven in a randomized control trial to improve outcomes.
Part of the burden of the system is the care after putting the MCS patient in the CCU. So I feel like your protocol goes through in details to help centers when they are implementing MCS insertion. The CCU care is also important as well.
Absolutely. I mean, it's really about having invasive hemodynamics to help guide weaning and escalation, to be able to change your medications, wean even vasopressors and inotropes, really have sophisticated mechanisms in place to monitor for vascular access complications, routine use of reperfusion sheets, really pristine cardiac intensive care unit care. So all of these things go into really getting really good outcomes for these patients.
Just a message to the centers who are interested to initiate these protocols. What kind of education and teaching need to be done for these patients, for these centers?
No, it's a lot. I mean, you really want to be able to treat cardiogenic shock from A to Z, the full spectrum. So it's about education within the emergency department and emergency room physicians. The cath lab is kind of well equipped to take care of these patients, optimizing and improving the cardiac intensive care unit. And one thing that people forget is really the importance of post-hospitalization care, being able to deliver guideline-directed medical therapy, ideally to improve patients' cardiomyopathy. All of these things are going into kind of improving outcomes as a whole. Each area has their own educational value, but there's more and more resources to be able to kind of help develop and grow shock programs locally.
Absolutely, and what you have done so far, increase awareness on the society level, and now SkyShock has their own conference just highlighting the importance of this shock management.
Exactly. So SkyShock is going to be October 13th through the 15th in Minneapolis. Yeah. We hope everyone will enjoy.
And there is a call for cases right now.
There's a call for cases right now. So if you want to be labeled the shock king and queen, submit your cases. We'll see if it's the best case and highlight it.
All right. Well, that's a call for everyone if you see that, and I think the information we'll put it also in the description of the video. Thanks, Dr. Babar, for your time. Really appreciate it, and thanks for all your hard work for Shock. Please watch his videos and others on CVI YouTube channel. This is Chadi Alraies from Denver, Colorado. Thank you so much.
Thank you.